Last night, a 28-year-old walked into my office. Healthy, athletic, successful career. But he sat across from me, staring at the floor, unable to make eye contact. Finally, he said, "Doc, I can't perform. It happened once, and now I can't stop thinking about it. Every time I'm with my girlfriend, I panic, and then nothing. I feel like less of a man." Then this morning, a 52-year-old came in. Similar story, different cause. And yesterday, a 68-year-old who thought his sex life was just over. 3 different ages, 3 different causes, but the same devastating question: what's wrong with me? If you're watching this right now, whether you're 25, 45, or 65, and you've struggled to get or keep an erection, I need you to hear this. You are not broken. You are not alone, and there is a solution. My name is Dr. Sanjay Gupta, and today we're going to talk about something that affects 1 in 4 men under age 40 and more than half of men over 60. We're going to talk about erectile dysfunction, and we're going to talk about it honestly. Let me start with something that might surprise you. A 2013 study published in the Journal of Sexual Medicine found that 1 in 4 men under age 40 seeking treatment for ED was under 40. 1 in 4. And here's what really concerns me. Research shows that ED affects around 8% of men aged 20 to 29 and 11% of men aged 30 to 39. These aren't old men. These are guys in their prime. But it doesn't stop there. As you age, the numbers climb. By your 40s, it's more common. By your 60s, it's affecting the majority of men in some form. Now, you might be thinking, okay, doc, but why? Why is a 25-year-old dealing with the same problem as a 65-year-old? The answer is this. The symptoms look the same, but the causes are completely different. And understanding your cause is the key to fixing this. Let me tell you about 3 patients. I'm going to call them Jake, Marcus, and Robert, because their stories, one of them is probably yours. Jake, age 27. Jake came in 2 months ago. Strong kid, works out 5 times a week, no health problems. But 6 months ago, he had one bad night with his girlfriend. Maybe he'd had a few drinks. Maybe he was stressed about work, but he couldn't get hard. It happened once, just once. But then the next time they were intimate, he started thinking about that failure. His heart started racing. His mind was screaming, what if it happens again? And guess what? It did. Because anxiety became a self-fulfilling prophecy. Now, 6 months later, Jake is avoiding intimacy entirely. His relationship is suffering. His confidence is destroyed. Psychological issues are the most common cause of ED at a younger age. Sexual performance anxiety affects up to 25% of men. Jake's penis works perfectly fine. The problem, it's in his head. Marcus, age 52. Marcus is different. He's been married 25 years. His wife is patient, understanding, but over the past 2 years, things have changed. It takes longer to get hard. The erection isn't as firm. Sometimes it fades during sex. Marcus hasn't been to the gym in years. He's gained 40 pounds. He eats fast food most days, and he's on blood pressure medication. Marcus's problem isn't psychological, it's physical. His blood vessels are clogged, his testosterone has dropped, his body is sending him a warning signal. And here's what scares me. Erectile dysfunction is a key predictor of cardiovascular events. This is particularly true for young men. When a man in his 40s or 50s develops ED, it's often the first sign that something is wrong with his heart, his blood sugar, his hormones. Robert, age 68. Robert assumed ED was just part of getting old. I'm almost 70, doc. Isn't this just what happens? No, it's not. Yes, aging affects your sexual function, but getting old isn't a death sentence for your sex life. Robert had untreated diabetes for years. His testosterone levels were in the tank. He was on 5 different medications, 3 of which cause ED as a side effect. Nobody ever put the pieces together. When I see a 68-year-old with ED, I don't see old age.
I see a treatable medical condition that's robbing a man of intimacy, connection, and quality of life. Do you see yourself in one of these stories? Maybe you're like Jake, healthy, young, but trapped in a cycle of anxiety. Maybe you're like Marcus, ignoring the warning signs your body is sending. Or maybe you're like Robert, resigned to a life without intimacy because you think it's too late. It's not too late, for any of you.
An erection isn't simple. I know it feels automatic when it works, but it's actually one of the most complex processes in the male body. It requires your brain to be in the right mental state, your nerves to send the right signals, your hormones, especially testosterone, to be balanced, your blood vessels to be healthy and open, your heart to pump blood effectively into the penis, and the smooth muscle in your penis to relax and trap that blood. If even one of these systems fails, you get ED. So let's break down the causes by age, because what's happening at 25 is not what's happening at 65. Young men, 20s to 40s, the psychological trap. What's happening in your head can affect your body and vice versa. ED can be a symptom of mental health conditions such as depression and anxiety. Here's what I see most often in younger men. 1. Performance anxiety. About half of those who struggle with ED cite stress as the reason they cannot get or keep an erection. One failure creates fear, fear creates more failure. It's a vicious cycle. 2. Porn-induced ED. With so much sexual prowess depicted in sexually explicit media like online porn, many young men feel they don't live up to the standard. Your brain gets wired to unrealistic stimulation. Real intimacy can't compete. 3. Relationship stress. Clients who are more romantic types may lose their erection when with a partner they don't know well enough yet. Emotional disconnection kills arousal. 4. Depression and anxiety. These disorders don't just affect your mood, they literally change your brain chemistry and hormone levels. But young men also face physical causes. Obesity increases the risk of conditions such as heart disease, type 2 diabetes, which can cause ED. Smoking can damage blood vessels, making it difficult to get an erection. High blood pressure reduces the body's production of sex hormones like testosterone. Middle-aged men, 40s to 60s, the warning sign. This is where ED becomes a medical red flag. Your testosterone starts declining about 1% per year after age 30. By your 50s, it's noticeably lower. Your blood vessels have been exposed to years of poor diet, stress, maybe smoking, maybe high cholesterol. They're getting stiffer, narrower. Erectile dysfunction is a key predictor of cardiovascular events. When a 45-year-old can't get hard, I'm not just worried about his sex life, I'm worried about his heart. Common causes in this age group are diabetes, which damages nerves and blood vessels, high blood pressure, which damages blood vessels, high cholesterol, which clogs arteries, including the ones going to your penis, medications, blood pressure meds, antidepressants, low testosterone, sedentary lifestyle. Older men, 60 plus, not just aging. Let me be crystal clear. Aging does not mean the end of your sex life. Yes, things change. Erections might take longer to achieve. They might not be as firm as at 25, but complete erectile dysfunction, that's a medical problem, not an age problem. In older men, ED is usually multifactorial, accumulated vascular damage from decades, multiple medications with sexual side effects, hormonal decline, testosterone, thyroid, neurological changes, prostate issues, or treatments. But here's the good news. All of these are addressable.
Now, let me tell you about the part nobody talks about, the emotional devastation. For a man, ED isn't just about sex, it cuts to the core of identity. I've had patients tell me, I feel like I'm not a real man anymore. My wife says it's okay, but I see the disappointment in her eyes. I avoid intimacy completely now. It's easier than risking failure. I can't even look at myself in the mirror.
The psychological burden of ED in young men is more pronounced than it might be in older men, as this is the phase of life during which many men expect to be highly sexually active. Young guys feel robbed, middle-aged men feel broken, older men feel finished. But here's what I want you to understand. ED affects every part of your life. It destroys relationships. Partners feel rejected, unattractive, confused. Communication breaks down. Intimacy, not just sexual but emotional, disappears. It kills confidence. You withdraw socially. You avoid dating. You feel inferior to other men. It causes depression and anxiety, which then makes the ED worse, which deepens the depression. It's a downward spiral. And the worst part, most men suffer in silence. Men may wait many months before seeking out therapy because they feel like they should be able to take care of this problem on their own. But you can't fix this alone, and you don't have to. All right, we've talked about the problem, we've talked about the pain. Now let's talk about solutions. Real, practical, proven solutions. For young men, psychological ED. If your ED is primarily psychological, medication like Viagra might give you a temporary confidence boost, but it won't fix the root cause. Here's what actually works. 1. Cognitive behavioral therapy, or CBT. This helps rewire the anxiety performance cycle. A sex therapist can teach you techniques to break the pattern. 2. Communication with your partner. Talk about it out loud. The secrecy and shame make it worse. Being calm and matter-of-fact about it may help you both deal with it in a proactive and positive way. 3. Mindfulness and sensate focus. These techniques teach you to be present during intimacy instead of trapped in your anxious thoughts. 4. Reduce porn consumption. Give your brain a break. Rewire it to real intimacy. 5. Treat underlying mental health. If you have diabetes or anxiety, get treatment. The ED will often improve as your mental health improves. For all ages, lifestyle changes. These work regardless of your age. 1. Exercise. A 2012 study found that among men under 40, those who were sedentary were more likely to experience ED than those who were active. Aim for 30 minutes of cardiovascular exercise most days. This improves blood flow everywhere, including your penis. 2. Weight loss. If you're overweight, losing even 10% of your body weight can significantly improve erectile function. 3. Diet. A Mediterranean diet has been shown to improve ED. Think fish, olive oil, vegetables, whole grains, nuts. 4. Quit smoking. Smoking can damage blood vessels, making it difficult to get an erection. Quitting can reverse some of this damage. 5. Limit alcohol. 1 or 2 drinks might relax you. 3 or more, that's causing your ED. 6. Sleep. Poor sleep destroys testosterone and increases stress hormones. Aim for 7 to 8 hours. 7. Pelvic floor exercises. Yes, Kegel exercises work for men too. They strengthen the muscles that help you maintain an erection. Medical treatments. 1. PDE5 inhibitors. Viagra, sildenafil, Cialis, tadalafil, Levitra, vardenafil. These work by increasing blood flow to the penis. They're effective for most men, but they treat symptoms, not causes. Important. The recreational use of erectile dysfunction medications may have unintended negative effects. One 2011 study found that recreational users reported 2.5 times the rate of erectile difficulties compared to non-users. Don't use these recreationally. 2. Testosterone replacement. If your testosterone is clinically low, replacement can help, but get properly tested first. 3. Treat underlying conditions. If you have diabetes, high blood pressure, or high cholesterol, getting those under control will improve your ED. 4. Medication review. If you're on antidepressants or blood pressure meds, talk to your doctor about alternatives that don't cause ED. 5. Injections. Alprostadil injections directly into the penis. Sounds scary, but they work when pills don't. 6. Vacuum devices. Non-invasive, no side effects. They can be effective. 7. Penile implants. For severe cases that don't respond to anything else, surgical implants are an option.
The key? Start early, be honest. Don't suffer in silence. Erectile dysfunction in your 20s or 30s isn't rare, and with the right guidance, it's often reversible. For younger men with psychological ED, the prognosis is excellent. Most recover completely with therapy and lifestyle changes. For middle-aged men catching early vascular problems, aggressive lifestyle intervention can reverse ED and prevent heart attacks. For older men, modern medicine has more options than ever, but it all starts with one step: talking to a doctor.
Let me leave you with this. Remember Jake, the 27-year-old? 3 months after starting therapy and having honest conversations with his girlfriend, he's back to normal. The anxiety is gone. The intimacy is back. Marcus lost 35 pounds, started exercising, got his blood sugar under control. His erections aren't like they were at 25, but they're functional. His marriage is thriving. Robert, we adjusted his medications, started him on low-dose Cialis, optimized his testosterone. At 68, he's having sex regularly with his wife for the first time in 5 years. These aren't miracles. They're just what happens when you stop suffering in silence and take action. Whether you're 25 or 65, your sexual health matters. It's not vanity, it's quality of life. It's intimacy, it's confidence, it's masculinity. Not in a toxic way, but in a healthy, whole way. You deserve to feel like yourself again. Don't wait. Don't be embarrassed. Talk to a doctor, because this problem, it's fixable. Take care of yourself. You're worth it.